Parker said, here's a quickie. And we like quickies. Hopefully this isn't a silly question. There are no silly questions. With the U.S. Department of Education's recent ruling on masks, what is Dr. Kung's advice on this? They want to know, Evelyn, where are you on masks? Now, I'm going to assume, Parker, and tell me if I'm wrong, that you're referring to the fact that they were saying that all kids need to go to school and all kids need to be masked. But everything seems to be changing every 10 minutes. So if you know something different than that, that's the assumption upon which we're going to answer this question, that all kids need to go to school, all kids need to be masked. With the asterisk that, and they have given an asterisk saying that it may not be possible for some people for medical reasons or behavioral reasons, which I guess, I don't know, is that a medical reason? Evelyn, are you interested in talking about where you are in the mask mandate?
I am. You know, autism has come, the generation of where, you know, what causes autism has been a discussion, you know, ongoing. And there is a certain component of research that shows that one of the environmental, you know, things that could set off, you know, autism is that it's an immune system dysfunction. And that means, you know, when our kids come in, I've seen so many kids, and there is definitely a significant group, their immune system does not work properly. They're either always sick or they're never sick. And both are of concern because something is wrong. So I come from that point of view, where I also come from the point of view in Asia, if you are sick, you automatically put on a mask so that you're not going to be contagious to other people. Mm-hmm. And it's a courtesy that is just like a normal part of how things run. So, but just from my idea is that if these kids have immune systems that are compromised, whatever we can do to make it safer for them, let's just do it. And a mask for me is not a big deal. Sure, it can be a big deal if the child won't wear a mask, but maybe those are the exceptions until we can teach them to wear a mask. Yeah. It's not that hard. It just takes time and patience. If you do it slow enough, and if you use ABA, we've taught a lot of kids, you know, most kids at CARD now are all wearing masks in our centers. And it can happen. And if they can't, it's okay. It can be an IEP goal and a part of the disability. That's the reason why they're not wearing masks. But we can teach all kids to wear masks, you know, no matter what their age, no matter what adult. It's just, you know, knowing what motivates them and being, you know, what parts are bothering them, like if they don't like the way it feels. But it can be done. I don't think we've had one child, you know, that I know of that we haven't been able to teach how to do a mask. Sometimes it's really quick and sometimes it takes many, many weeks, you know, but it eventually happens if you stick with it and if you have somebody really targeting the behavior as something that is necessary. And because so many of our kids have immune systems that are not good, and we don't know how COVID affects people, and the scary parts of COVID right now, and how they're affecting kids. You know, we just don't know enough. So if we can do anything that makes people safer in general, I'm all for it. You know, I don't know how that stands for people.
And you know what, thank you for coming at the issue in that way, because I think that's a real clear way of looking at it. I find myself saying this a lot lately. If we take everything else out of the equation and think about what is best for the individual, right? And especially when it's a kiddo, because sometimes, and especially when it's one of our kiddos and they can't always language what they want. Like when we're talking to a 25-year-old who already has full command of language, of course we need to be saying to them, what do you want, and listening, right? But when it's a kiddo that is very young and has a compromised ability to communicate their needs, like, you know, it becomes so essential that we're always coming from that place about what is the best thing for this individual. And I think what a lot of people leave out is just what you said. Our kiddos across the board, we know that there is some kind of immune dysfunction. I don't think I've met a single individual on the autism spectrum or a parent or a caregiver of someone who's on the spectrum who didn't say, yes, I think that is true for my kid. In my whole time, I don't think I've met a single person who said, oh yeah, no, I think my child's immune system is right on the money, perfect, you know. And if we're coming from that point of view, it suddenly gets clearer, right? That yes, there's the behavioral issue about getting them to wear the mask, but oh my goodness. I remember the early days of this COVID when we were all freaking out about have shoot, do you have me? My internet. What is up with my internet lately? It's got to be like a neighbor who's like piggybacking onto my. It's the same time every show now. We're going to solve this, Traven. But I so apologize. I was saying, I remember back in the beginning, the first time I put on a mask to go out and work in my garden, because my garden is very close to the street, and I was like, I can't do it. I'm not going to make it. I can't breathe. I don't know how anybody does this, right? And now I wear a mask 8 hours, and I forget that I have it on my face. And every single person who wrote into this show in the beginning and said to you and said to Dr. Grampy Shea, my kid is, with all due respect, my kid is the kiddo that this is not going to be able to happen. And I believe them. I'm like, I don't know your kiddo. I believe that, if that's the case, but then you guys still gave advice and said, well, let's start really slow. Let's do this, step by step, and do all the good things we know about ABA, that we're not going to overwhelm them with it. And we're going to give them rewards for doing it a little bit. And we're going to move the dial along. Every single one of those parents says, it's like a miracle. My kids wear a mask. They wear it better than I do. They're more comfortable with their mask. Like, they're more worried now about when masks aren't going to be used.
Exactly.
How they're going to get them to not wear the mask. I'm like, that's kind of crazy that we went from, being so concerned about, are the kids going to wear the mask, that using good ABA, we've gotten to the point where the kids actually like it. They actually, and I'm there too. Like, I don't know that there's ever going to be a time that I'm not going to wear a mask in Costco. Do you know what I mean? Because it's better. It's better for me.
Yeah. No, I wear it now because I have allergies. It helps my allergies so much when I go for a walk.
Yeah. I mean,
Yeah.
I've got allergies this morning because they're cutting down trees by my house, and I'm not wearing it in my house. I should, because then I would have less of an issue. But yeah, I think, I think it's tough for people to go, oh, we're all going to be in the classroom and the attempt is going to be there to get everybody to be masked. But I'm a former teacher, and I have so many friends who are teachers who all they want to do is be back in the classroom.
Yep.
Oh my gosh, all they want is to be back in the classroom, but they also have kids, and some of their kids are compromised, and they're like, I want to go back into the classroom, but I'd like to be as safe as I possibly can. And, it's not ideal for anyone, but if this is, we know that the transmission will be less if we're masked. Like that, there are many things we don't know, but that seems very clear from everything that we have seen. So I hope that I want to see what Parker wrote back in, but I hope that's really, really helpful.
Yeah. And I have to say, like, when I work with families, one of the main requests from families is, how do I get my child to tell me when they feel sick? And then how to deal with, like, medication or figuring out what symptoms are. And it's related to all those things that are when our kids can't communicate something that's concrete, and and so I've worked with so many families on teaching kids how to communicate when they don't feel well, and how, the rest of us, if we wake up and we kind of think we have a sore throat, we can tell somebody so we can try to prevent it from, like, building up. And our kids don't have that ability. And that communication, a lot of the people that we work with can't identify what their bodies are actually feeling. And it's just so abstract that, if we can just keep them from not getting sick, life is just so much better. Because once they are sick, how can they tell you that they have a headache? Because there's nothing outside that shows them that they have a headache, or they can't breathe unless they're wheezing. But then by that time, that means it's at a severity level that's way more than it should be. And that is a concern that all families have. So that really is why I come from it from this point of view. If we can prevent people from getting sick, especially people who have compromised immune systems, just do it. It's not a big deal to wear a mask.
Well, and I want to say to what you just said, I remember when you encouraged me to send my son to go to a developmental ophthalmologist, was it? I
Oh,
always
yeah.
get this, yeah. And one of the things that you said to me at that time is that once kids are a little bit older and have a little bit more language, we can find out a lot more about what they're seeing.
Mhm.
And you were saying to me that sometimes it's not all that uncommon to, to have a 7 or 8 year old who's now able to communicate go to the doctor, and we find out that they've been seeing double vision and that they never brought it up because they thought that's what they were
Yep.
supposed to be seeing.
Mhm.
And I went, oh gosh, I guess I hadn't thought about it from that perspective. So same kind of thing, that sometimes they don't know to tell us that they're not feeling well.
And actually, that's common among typical kids.
There you go. There you
That's
go.
a lot of typical kids just think this is how the world looks. And then you
Yeah.
give them glasses and they're just like, I never knew that's what,
That
what it looked
that's what
like.
it can be. But